Did I just have a comp? If you get too many zeros, you fail. It's okay, you'll be fine. Alright, so hey, what's up? My name's T. Welcome back to my channel. If you're new here, then please make sure you like, comment, subscribe. If you're not new here, then thank you for welcoming back to the channel. So today I'm just want to talk about the reality of being in dental hygiene school, and then I'm going to make another video after this about the reality of being a dental hygienist, like your first year being a dental hygienist, okay? So if you like that type of content, definitely make sure you keep watching. So some things that happen when you're in dental hygiene school is that you end up in this space where you're constantly in a rat race. You either have a quiz to do, you have a test, you have exams, you have clinic happening, which is where you're practicing on each other and on patients, and you just have all of these things that you have to do. So with that, it starts to get to a point where you're just overwhelmed, possibly. It's a lot of studying, it's stressful. And remember, you're cramming all this information that you have to know for your whole lifetime in this career in 18 months, like 18 to 24 months. So I feel like people expect dental hygiene school to be like regular school where you just come, take tests, study, do exams. But the problem with dental hygiene school that they don't tell you is that you have a combination of clinic and doing regular classwork as well and regular tests. So they have what's called clinical experience and didactic experience. So your clinical experience is what you do in clinic, which is in a clinic where you practice on patients and practice with your student classmates as well. And you do clinical rotations as well. So the clinical rotations take you to different facilities so you can practice and be with real patients in other facilities. Didactic is basically a funny way of saying lecture. So didactic is your actual classroom work. That's what you're doing, like you're studying and you actually sit down in a lecture class with your professors and they're doing your exams and tests and you're learning in the classroom. Clinic is still a classroom, but clinic is clinic. Clinic is clinic. So those are the two differences, and that's why dental hygiene, you have a program that you have to get into, and I've already made videos on how to do prerequisites. So if you want to check that video out, you need to go check that video out on prerequisites and how to study and how to get into dental hygiene school and how to apply to dental hygiene school, because I already made videos on that. That's one difference that they don't let you know up front. Like there's really no way for me to explain the experience that you have, but imagine you have clinic Monday through Friday, 8 to 4 or whatever, and 8 to 4 really is 7 to 5 because you have an hour to set up and an hour to break down. So well, you start breaking down at like 3 o'clock, but you set up early, like 7 a.m. So it's just like there's no night classes. In most dental hygiene programs, there's no night classes, so it's very hard for you to work while you're in this program. If you do, you work at night or you work on the weekends. But remember, you still need time to study for your exams. And you also are in clinic and you're doing what you have what's called competencies. So in clinic, you're having an appointment with a patient that is not just an hour like it is in a regular world. You have a set of patients that you have to see throughout the semester. And those 5 patients all have something different about them, or 3 patients have something different about them, and you're seeing them over a course of weeks until you're done with their appointment. So they may come in 4, 5, 6 times to complete everything, and honestly, you're not even doing their cleaning the first day. The first day is literally just data collection and going through their medical history. So they're teaching you how to go about a clinical experience and an appointment with a patient. So when you get out of dental hygiene school, you have to create a pace because you're used to moving so slow in dental hygiene school because your appointments are so long with the patient that when you come out in the real world and you only have 45 minutes to an hour with a patient, in some really horrible offices only 30 minutes. Like, that first year hygiene school is hard. After hygiene school, it's hard for you to get used to like a fast-paced environment. So back to what I was saying about clinic. Like, so you have clinic from 7 to 4, right? That's Monday through Friday. If you have clinic from 7 to 4, do you think you have time after work to really hang out and chill? Not really, because you have to study. And then those competencies I was talking about, those competencies are basically like verbal tests while you're in the chair with the patient or you're walking around clinic. So let's say you're in clinic right now and you're in the sterilization area where we go and take the dirty and the clean instruments from, like the laboratory. You go in there and one of your professors comes up to you and like, hey, what gloves do you have on right now? That's an easy question, but like something like that. And you don't even know that that question is leading you into what's called a sterilization competency or infection control competency. So you're like standing there like you're maybe or may not know that you're going into a comp right now. So you're like you're stumped, and they're like, just tell me what gloves you have on. Are they rubber? Are they latex? Like, what are the gloves made out of that you have on? What do you use these gloves for? And you're just like blanking out, or you answer it but you don't realize like you've worded it or phrased it in a certain way that makes the question kind of incorrect. Like, they try to trick you into getting an answer wrong. Some of these professors be out here really doing dirty. So anyway, so now you're just getting this verbal test done, and you're just like, once they walk away, you're like, oh my God, like, did I just have a comp? And you're just in shock. So competencies are listed by topic. So throughout your semesters in clinic, you'll have competencies. So you can be with the patient, and remember, you're being supervised by dental hygienists because you don't have a license yet. So while you're with the patient, they are there. They kind of stand next to you while you're with the patient for the first semester, but after that, like, they kind of walk away, let you do your thing. They're still watching from a distance, and then they come back and they like, okay, like asking you questions like, okay, so what instruments are you going to use first? And it makes you nervous. It's like nerve-wracking. And you're doing it in front of a patient. Sometimes it's not your family, it's really like a literal stranger. And competencies were like my worst thing, because if I don't know the answer, I don't want to make nothing up, and I don't want to say I don't know. So I'm just like sitting there for mad long, like 10 minutes, like, and then now I got a 0 in that competency, or I got incomplete, and if I can make it up, then I'll make it up another day. But it's like, you have the semesters were like 3 months long, or depending on what school you go to, it's kind of sped up, or like 2 months. You don't have that much time. Like, that was your chance to get that competency done out of the 12 competencies you have. So it's like, damn, I could have got that competency done. Like, so comps was like the hardest thing, like, for me, because it's like my brain just be like blank as soon as they walk over and they start talking to me. Like, I get so scared. Like, I just was so nervous. So my advice is, don't get stressed out, don't get nervous, don't get anxious. Just do your best with the comps. Like, you got this. Like, you're smart, you know this information, you studied, you on your game. Like, just be kind to your professors, get cool with them. There are some of them that are really mean and they're not nice, but just get to know them and know their teaching style, and get to know them, and then you'll be okay. But comps were the worst. Another thing they don't let you know about dental hygiene school is not even just the comps too, but to know like how to balance everything. Like, you're getting patients from off the street most of the time, because you're sometimes not going to have a patient, and in order to pass clinic, you have to have patients in the chair. So majority of my semester, like my 3rd semester, I didn't have any patients really. Like, I was begging people to come and be my patient for me. And I lived in New York, and my family lived in New York too, and I was going to school in Connecticut for dental hygiene school. I went to the University of New Haven. They literally could not come and help me out because they had work. So I had no patience sometimes. Or the dental school that you go to, dental hygiene school you go to, will have patients like in a notebook or whatever, and each semester they call them in as a recall, like, hey, like, these are real patients who want to see you, because this is their only dental office that they go to technically. Like, so they'll come in and they'll help out the students by coming to all these appointments. But sometimes, like, they're regular people too, so they'll cancel. So I'll get a 0 or incomplete for the day. And like, it's a lot of pressure because you have to do all these things within like that 3-month semester. So it's like, if I don't have a patient, that's not my fault. Like, what am I supposed to do? So luckily enough, like, I would find people. I would have to go to like McDonald's and like literally going around campus asking students, can they be my patient? Getting cool with people in my class, in my dental hygiene class, that know somebody that knows somebody that knows somebody that can come in and be my patient for me. Like, I had such a stressful time in dental hygiene school, but that's something that they don't tell you. Like, you have to have somebody to work on, for them to test you on, for you to get graded. So if you have no patience, you get a 0. And if you get too many zeros, you fail. If your professors in clinic are cool, or your faculty are cool, they'll help you out and they'll negotiate with you with those zeros. But if you look like you're not hustling and you don't care, you just sitting on your phone, you just helping people probe, you don't look like you're trying to be proactive in getting a patient to come in for you. I've seen that. I've seen girls in my class fail out because they were using clinic as like a joke. And it's like, you have to be understanding of the fact that somebody else can be in your spot. This program is very competitive. Out of the 1,000 people that applied, 100 people got in, and only 30 people are going to graduate. So why would you waste their time? Like, somebody else could be in your spot. So I understand why they kind of like shaded those girls, but my biggest thing and my biggest advice in hygiene school is make sure you have a good study plan, get in a study group, make sure you have really good friends around you, block out the noise from your family and your friends, your boyfriend, your partner, whoever, girlfriend, boyfriend, whatever. If they're giving you stress because you don't get to see them anymore, let them know that this is something you're dedicating to, and it's very stressful, and you have to study. You need to pass this exam. You need to study your instruments. You need to be, you know, on your game. You have to practice on your type it out with your instruments. Like, you don't have money to go out. Like, you know, like, just let the people in your life know and yourself know that you can do this, but you just have to be focused. Like, it's literally the hardest thing that you'll ever do in your life, but it's only for 18 to 20 months or whatever program you're doing. Like, it's short as fuck. It's gonna go by fast. I know sometimes it might feel like, fuck, I hate this. Like, I'm scared. Like, I'm failing. Like, I'm barely passing. I have no social life. I can't get my hair done. My face looks crazy. I'm breaking out. I'm stressed out. I'm gaining weight. I'm not eating. I'm not sleeping. Like, it's okay. You'll be fine. So I definitely suggest that you continue to look into like more dental hygiene videos like this to help you. And if you want more videos like this, or you want any study tips on how to study or how to adjust to dental hygiene school, then let me know. But make sure you hit the like button. That lets YouTube know that you like these videos. And make sure you follow me on TikTok, YouTube, and on Instagram. I made a regular Instagram for dental hygiene now. And that Instagram is going to be here on the screen. My personal Instagram is here. And if you follow me on TikTok already, thank you so much. I'm almost at like 5K in my head. I'm at I think the last time I looked I was like 3.6K on TikTok. So anyway, thank you for coming back to the channel, and I will see you in my next video. Bye. Yeah.